Hey, today's veterinary nurse, Coach Salima, back with a few more of my favorite intentional movements to help you prevent injury and protect your body while on the job. Today we'll focus on the knees, working to strengthen the muscles that stabilize the joints and then stretch the iliotibial or IT band, which can contribute to knee pain. Always confirm with a healthcare professional before adding any of these movements to your routine, and if anything causes you pain or discomfort, discontinue immediately and seek medical attention. Our first strengthening movement is a side lying hip abduction, and for that we'll begin on the ground. You'll begin in a comfortable side lying position, either up on your elbow or laying all the way down. Make sure that your hips are stacked and you have a neutral pelvis. You'll bring that bottom leg forward, slightly bending your knee to create a stable base for this movement. Then you'll flex your foot, engaging that gluteus medius as you lift your leg up off the ground, no more than 6 inches, pausing at the top and gently releasing. Avoid arching your back or letting that top leg rotate. You'll complete 10 repetitions on either side for a total of 3 sets. Now, as a progression, you can add a band or a weight to that top foot. As a regression, we can do this in a standing position, lifting that leg out to the side, working the same muscle group. Our second strengthening movement is a high squat forward backward walk. For this, we'll begin in a standing position with feet about shoulder width apart. And you'll stay heavy in your heels as you push your rear backwards, sitting into that high squat position, as if you're sitting into a chair. Make sure that your knees stay behind your toes, and to protect your lower back, avoid that anterior tilt and instead maintain a neutral pelvis and keep your core engaged. Now, to initiate this movement, you'll shift your weight over to one side as you pick up your opposite foot, replacing it about 6 inches in front of its original placement. Then you'll shift your weight over to the foot that you just placed on the ground, lift up that opposite foot and replace it. You're taking this slow walk 5 steps forward, then using the same technique to walk backward, nice and slow, staying in that high squat position. Your goal is 5 of those forward backward cycles. Now, as a regression, limit your range of motion. You don't have to go quite so low into that high squat. You can even maintain a standing position, shifting your weight, and you're still working all those tiny stabilizer muscles as well as your balance. Now, as a progression, you can hold a weight, add a band below your knees, or increase your range of motion. See how low you can go. Our first stretching movement is the IT band stretch. For this exercise, you'll begin in a standing position and you'll cross your legs. So bring your right foot in front of your left, crossing your ankles. Keep your left leg straight. That's the side that will be stretching. Then you'll bring your arms up and overhead and reach for the right side, feeling that stretch in the lateral aspect of your leg. You can hold this for 20 to 30 seconds, then gently release and repeat on the other side. Complete 2 up to 4 repetitions on either side. Now, as a regression, you can remove that overhead reach, so cross your ankles and then use your torso to initiate that reach, feeling that stretch in your left side. Our final stretching movement is a supine glute stretch. For this, we'll begin in a supine position with legs extended. You'll initiate this movement by bringing one leg up off the ground, guiding your knee toward your chest. Now grab on behind your leg to deepen that stretch, keeping your other leg in contact with the ground. Make sure that both hips as well as your shoulders stay planted in the ground. You're holding this for 20 to 30 seconds, then gently release and repeat on the other side for a total of 2 up to 4 repetitions. Now, as a regression, you can bend your opposite leg and plant that foot into the ground.